Welcome to Stay Alive with Church Alive, and this is your host, Reverend Dr. Timothy Birkett. We're now going into part 2 of this book, Medical Marijuana, Real Life Success Stories. And we are blessed to have Dr. O'Brien, who stayed back with us for part 2. And we're going to ask you, Dr. O'Brien, first we want to mention to our audience that this program is not covered by any insurance. But Dr. O'Brien has a special offer for all those who would like to get this book, and you can respond. He'll tell you about that right now. Dr. Thomas O'Brien.
Right. You can purchase the book on Amazon.com, or if you do a search, you just put in my name or put in medical marijuana, real life success stories, and then it'll see, it will come up. You just have to click the link and it'll bring you right to Amazon.com. But any one of your viewers, our viewers, within a tri-state area that see this show and they suffer from one of the qualifying conditions, since medical marijuana is not covered by insurance, there's a reason for that. This is not federally, it's not accepted or approved by the federal government, so no one's going to want to touch this. This is state by state, so it's cash only. I will honor I'm going to say a Bishop Birkett discount or a Church Alive discount. So if you call my office, we're going to have the information on the screen, but make sure you mention Church Alive Community Church or Bishop Birkett, and I will offer a discount. So I'll give you a discount off the initial visit.
Now, Church Alive, I want you to know, is spread across the United States now, since on Facebook and whatnot. And so, folk, wherever you are and you are a visitor of Church Alive, come on, or you're watching it on Facebook or YouTube, or Instagram or whatever, yes, that discount is good for you. But you have to mention that you are watching it right now where you are. You're watching it on Church Alive television program. Yes, is that okay?
Yep.
All right.
Now, let me just, one thing.
Yeah.
I have patients from other parts of the country, individuals that will give me a call. Yes. Unfortunately, this is a state-by-state law. Not all states approve or offer medical marijuana to their population. Unfortunately, I cannot treat individuals who live outside of New York State. That is New York State's rules, and within the rules and regulation to be able to prescribe, you must be a resident of New York State, and then I could prescribe.
That's if they want to be a patient.
That's if they want a patient.
But if they want education,
that's right.
They can get this book in Timbuktu, Jamaica.
The whole world.
The whole world.
The whole world.
Okay?
This is the whole world.
Okay, and folks, I would get this book, and it's a valuable book there because opium, and we're going to talk about that, is spreading, not spreading, but it's becoming a part of America and a part of the world for the success stories that it is bringing to people and their health conditions. And we're going to talk about opium in a few minutes, but I feel that as the information goes out, you need to be educated, because some information going out is not correct. But I can tell you, this book is an education for you, for anyone in these days in which we're living in. We need to be educated. The Word of God says, seek knowledge, and above all, get an understanding, okay? That's what this is all about.
Right.
Medical marijuana, real life success stories. Dr. O'Brien, I'd like to go into, you mentioned, I was amazed at how medical marijuana is being used towards many illnesses.
Yes.
Such as Parkinson's disease.
That's correct.
Such as diabetes.
Yep.
Okay, you want to deal, I read this and it is fantastic. How it's used and the success. Tell us.
That's right. Well, let's be a little bit more specific with diabetes. We're referring to a neuropathic pain, and that'd be diabetic neuropathy, and that is pain that you develop as your diabetes advances. You have uncontrolled blood sugar, and that's the definition of diabetes. We have what's called macro and microvascular pathology. Hardening of the arteries, or atherosclerosis, arterial sclerosis, and then we have lack of blood flow, lack of oxygen going to the nerve endings, and you start to lose sensation. And when you lose sensation, you can start to develop cuts and infections, and we end up losing amputations. You go with the toes, and then you go at the ankle, and then to the knee. But before we get to that stage, you start to lose sensation, you get the burning sensation, the pins and needles. That's what I'm able to treat with medical cannabis.
Okay. Now, Parkinson's disease.
Yes, Parkinson's disease, that's a medical condition where we're losing a chemical in the brain. It's not being produced anymore, and then you start to lose function. We have control of the muscles. So there's other side effects that you see, but the biggest one is your muscle will get the rigid movement. Not able to walk through a door frame, like they get the shuffle step, and when they enter a door, they kind of like get stuck there. We have what's called pill rolling or lip smacking, and that's due to the lack of chemical that's not being produced. So what we can do is not treat some of the side effects of what that occur from the condition. We're not going to, people want to use the term cure. There is no cure in medicine. We use treatment. Cure means that the condition will never ever come back. So I can treat some of the sequela, some of the other issues that are associated with Parkinson's.
That's what you mean. Now, how is it used then, medical marijuana?
Sure.
How is it used for I read in the book, and folks, you need to really get this book because it is an education. I'm asking them questions so that, because you don't have the book.
Right.
But if you have the book, you wouldn't be asking a lot of the questions. But I'm doing that so that you can get this book.
Right.
You got it? You got to get it. All right. Now.
Yeah.
We mentioned Parkinson's, we dealt with diabetes, and what about muscular sclerosis?
MS.
MS,
yes.
right.
Again, that's a condition. Multiple sclerosis.
Right.
Okay. MS. We're dealing with conditions where you have the spine and you have the central nervous system. We have a coating. And it's called a sheath, and think of a cord, a power cord. You plug the power cord into the wall, and you have wires. Within the wires, we have a rubber or a plastic, a vinyl coating over it, so you don't get shocked. But that also, it's an insulator. We have the same thing within the spine. We have an insulation. It's called a myelin sheath. Well, what happens is the myelin sheath starts to deteriorate. Why do we get this? Unknown. Is it genetics, or is it due to medicine, or is it environmental influences? Is it generational? We're still trying to work that out. We're not able to pinpoint it, but we know there's something's going on, and it causes a deterioration of that myelin sheath. When you lose the insulation, the nerve signal, the conduction decreases, and it gets to a point where the nerve conduction stops because the myelin sheath, what we call the gap in between, increases, and the signal's not able to move forward and tell the body what to do.
This is when you're getting up in the morning and you got the terrible back pains.
It's more, you're going to start to seeing the spasms and the cramp and uncontrollable. You're not able to control your muscles because the signal's not there. It's on, it's off, it's on, it's off. So what I can do is I treat the pain that's associated with it as well as the muscle spasms. Some of the studies suggest that we can slow the progression of the disease.
So this is more muscular.
Muscular.
Because I noticed in the book it also speaks about severe back pain.
Yes.
And I'd like to get into that. And where you don't want surgery. Okay?
Right. Well, I have most of my patients now are suffering from chronic pain. It could be due to cancer. I have a lot of patients because with associated cancer. They have post-surgical pain because they cut through nerves. You have nerve damage. Then when I have cervical and lumbar disc pathology, where they have a disc bulge or a disc herniation and it's impinging a nerve. Some of them had surgery to correct it, and they still suffer from pain. So I can treat that with medical cannabis. So to have an understanding of how we treat. In New York State, we do not have the bud itself, the flower, or some people a joint. We have the plant itself, and we grind down and extract out oil from the plant, and then we have 3 different ratios, because there's 2 chemicals that we use. They're called cannabinoids, and we have 2 chemicals, and in the book I explain this. It educates you. I wrote this book that the reader, a layperson, can understand. It's a textbook with no scientific Latin terms, no biochemistry. I break it down that the average person can understand this book, and they can see the sequence of...
It's amazing, this
Great.
book.
Well,
Right.
I want the reader to understand my thought process
Right.
and how I make decisions, as well as what the patient was suffering, and you're walking the path with them as their initial office visit to the end of their treatment to where they are with me today. So you can see this. Now, getting back to the pain, I will choose a specific ratio based on the type of pain, because you have different receptors, different pathways going up to the brain or just going into the spine and back out. So I have to choose a different ratio based on the individual's needs. New York State offers what we call delivery systems, and I explain that in the book. Every year the New York State allows to increase the type of delivery system. But we have vapor, that's like smoking an e-pen, where you see everyone that's smoking electronic pen.
Right.
Like for cigarettes, the nicotine, we have the same thing, but in the tank it has the oil. Then we have oral. It could be either a capsule or a pill, or it could be a sublingual drop, what we call a tincture. And each have benefits. Some there's... I'm not too big on a capsule because the expense is a little bit more expensive, and then the onset of action is longer. That takes about an hour and a half to kick in. So if you're suffering from pain, you need relief now.
Right.
If you take a capsule or a pill, it takes about an hour and a half before you feel the effects. It has to be digested, broken down, absorbed. Has to be processed by the liver, and the liver will release the metabolites, and once it hits the bloodstream, those chemicals will look for those receptors and then to decrease the pain. So if you're suffering from pain, that's not my first choice. If you need quick onset, I advise going with the vapor. Onset of action is only 90 seconds. 90 seconds and you're feeling the effect. If you need quick relief but not that quick, then, or they don't feel comfortable using a vapor, then I say try the tincture. You put it underneath the tongue, hold it in so we can bypass the liver. Onset of action is about 20 minutes, give or take 10 minutes. I've had patients claim that they felt the effects in about 10 minutes, but typically 20 minutes.
Right.
So depending on the individual's needs, I will cater and tailor my treatment for their condition.
Now, cannabis is natural.
Yes.
And that's the thing that tell us exactly in the natural form, because a lot of people take, medication.
Right.
Okay. Medication side effects.
Yes.
Cannabis, what are their side effects? Or are there any?
Sure. Well, the medications that we take today, they're synthetic. They originally came from a plant. That's the first thing I educate my patients on. Almost all medicines we take today originally came from a plant. And then the scientists that work for pharmaceutical companies, they figured out a way that there was a chemical in that plant that did a specific function. Okay, and they figured out a way to synthetically make it and then sell it for mass production.
Right.
With medical marijuana, medical cannabis, it's the plant itself. It's not synthetic. We have, I think it's K2, which is a synthetic form, and that's where you hear the individuals literally falling down and dying or being rushed to the hospital right when they take a hit, because that's synthetic. That's not what we're talking about.
That's the point that I wanted to clear. In the book, it makes it very clear there is two ways to look at this.
Right. So this is the plant itself, okay? The cannabis plant. So you have the stem, and then you have the flower. The stem is what we call hemp, and that is CBD dominant. There is a little THC in it. Then you have the actual bud or the flower, and that is THC dominant with some CBD mixed in. So they take the plant and they grind it down and they extract out the oils from the plant, and we use the cannabinoids. There are approximately 113 cannabinoids within the cannabis plant. You see how the names sound very similar?
Yeah.
Cannabis plant, cannabinoids, and this is called the endocannabinoid system. All that means is we have receptors in the body, and when a cannabinoid enters our body, it has an affinity and it binds to the cannabinoid receptor. That simple. It's natural.
It's natural. Yeah.
Natural. So it's already built in our bodies.
Right.
It's endocannabinoid system. It's already in our bodies. So we take that plant, grind it down, extract out the chemicals, the cannabinoids, the oil itself. The two main chemicals are tetrahydrocannabinol, THC, and cannabidiol, CBD. Based on the ratio, the percentage of THC versus CBD, we will choose that and prescribe it for the specific condition.
Right. We have a lot of seniors who suffer from what they call arthritic knees, and I have a brother in the church who really goes through a lot of pain with arthritic knees, arthritis. It's not in the book, but when you talk about back pain and whatnot, how does that? How would the cannabis affect this particular situation?
So let's say arthritis, you have pain, and it's typically inflammatory pain.
Right.
And CBD has anti-inflammatory properties. I love CBD. You asked me a question to follow up from the last question about maybe side effects. What are side effects? So you have THC, tetrahydrocannabinol. That particular chemical has CB1 receptors, and those receptors are primarily found in the central nervous system. So if you take a lot of THC, then you'll start to feel the psychoactive properties, and that'd be the stoner's high. Some people get very paranoid, some people get anxious, some people get the munchies because it's an appetite stimulant, or they get sedation, they fall asleep. When you get into recreational marijuana, the THC is very high. So let's put things into perspective. During Woodstock in the late 60s, the THC was about 20 to 25%.
Right.
25%. Recreational today, it's as high as 91%. That's a tremendous difference in strength.
Right.
So if you're using recreational, we're going to stimulate a lot more CBD, or we're going to bind to more CB1 receptors, and then we're going to see more CNS side effects. And that would be your psychoactive properties, your stoner's high, your paranoia, anxiety, the munchies. Everyone always says, I got the munchies, potato chips, or they're just going to fall asleep. Okay. Now,
because I don't want people to think that medical marijuana is what we're talking about. So let's clarify that.
Yes, I was just discussing recreational.
Okay.
And that's because the THC can be as high as 91%.
Okay, recreational and medicinal. Explain those two.
Sure. Well, they're the same exact plant.
Yeah.
The difference is the ratio of THC to CBD.
And explain that.
Okay, so you have the two chemicals that I explained, the cannabinoids, tetrahydrocannabinol, THC, and CBD. Okay, structurally they look identical, except CBD is lacking one bond, therefore it has different receptors because it has a different characteristic. Those are the two main chemicals that we use to treat medical conditions. Recreational, the THC, that has THC has the psychoactive properties. Recreational, that's what gets you high. That's why they want to do it. They want to have the CNS, that effect, that euphoria. Some people want the anxiety. Some people want the paranoia. Everyone's different.
We're not talking about, the book makes it clear that you're not talking about medicinal. We're not talking about treating something. We're talking now recreational.
This is recreational.
Okay.
Yep. My book is not about recreational. This is about medicinal. And right now I'm describing the difference between recreational versus medicinal. Right. So the recreational THC is going to be very, very high, and we're going to affect the central nervous system. And that's when you're going to start to see the spicoli, at fast times we are high, the stoner effect, the sedation and falling asleep. With medical cannabis, the THC is going to be in the 20-25% like it was back in the 60s. Okay? So the goal here is to make you comfortable and functional versus being high and zooted, out of there, just tune out and turn off, they're out.
Folks, this is the reason why you need to get this book.
Right, so you can understand.
Because a lot of people have it the misnomer way,
Yeah.
or what I see on the street corner when somebody's stoned out,
Right.
or they got it where somebody's running around the street uncontrollable, and then you say, oh, what are they using? Oh, they're using marijuana. But there's a difference, and the book clarifies that.
That's correct.
And we're not talking about recreational marijuana.
No, this is medicinal.
Exactly.
Medicinal, yes.
Right. And
it's very, very. Let me. When you're buying recreational,
Yeah.
you're getting it from a dealer.
Right.
Do you know that dealer? No.
No.
Maybe, but.
And he's not writing a prescription.
No.
Anyway.
And you don't know the
Right.
source.
Yeah.
It could be laced. Let me explain. Cannabis, the plant, has 400 chemicals.
Right.
So when someone smokes the bud, someone smokes a joint, recreational, theoretically, and I'm saying theoretically they're inhaling 400 chemicals. It's more than that. They're using rolling paper.
Right.
That cannabis they bought may be laced with other chemicals,
Mm-hmm.
so that 400 goes into who knows how many more chemicals, and sometimes it's spritzed with butane. You know, butane is lighter fluid, and because it's dry, they want it to spark up so it burns better. So you're inhaling who knows how many more chemicals. With medicinal cannabis, we know exactly what you're getting because we're extracting out THC and CBD, and it's a specific ratio. There are no additional chemicals. It is not laced, so you're getting a pure form of THC and CBD. There's no lacing. There's no additional chemicals.
A good illustration is when you go into the supermarket and go to the vegetable stand and you see these lovely red apples, and they're all shiny and they look beautiful. And then you go over to the health food area and you see some apples, but they're not shining, okay?
Well, they're smaller.
They're smaller. Now, the situation is that you're chemicalized to keep that beautiful piece of fruit. They spray it. They add a lot of things that are going to affect you.
That's correct.
Okay? On the other side, it doesn't have all of that, but it's natural. That's going to help you. Okay?
Yes.
So, folks, that's my that's my understanding of what you're saying.
Yes.
And how it's almost commercialized and for recreational purposes.
Right.
Okay? And medicinal purpose is prescribed to treat you and to treat the problem that you have.
Exactly.
And not to make you feel high into another world of recreation.
That's
all right?
that's correct.
So the recreational is added things to it.
Yes.
They
Well,
add some things to it.
Yep.
Okay, that will enhance the recreational opportunity you want. Whether you're rolling it in special paper or whether you're adding something, to juice it up.
That's right.
Okay.
That's right.
And there's where you take away the natural. Okay. Then actually having it used because you have an illness.
Right.
Okay.
Right. Exactly.
Folks, that's the best I can do to help you. You got to get the book, okay? Because the book is the reason why I can explain it the way I did, and that's because I read the book. Okay. Now, once again, how can we get this book?
Yeah, you can go onto Amazon.com in the search bar.
Right.
You just type in either Dr. Thomas G. O'Brien II and hit search, and my name will come up and you'll see my book. Or you can literally type in medical marijuana, real life success stories, and the book will come up.
Okay. Now, what has been the, there are medical doctors and people who read the book, and what are some of the statements as to the quality of the book, the intake of the book from the professional world?
Yes, well, so far the feedback's been positive. I'm getting plenty of reviews on Amazon.com. I'm under several professional book review sites. So everyone's happy. They all say the same thing. What's in common? The terminology, the education, the understanding, and what they took away from the book. That they were able to understand the language and how it's being used, and they now understand the difference between recreational versus medical marijuana.
Now, there's some contributors to this book in your life that brought you to write the book. We want to give them the consideration at this time. So these are folk that you would like to just say thank you.
Yes, well, I had Again, this was a dream come true for me. My parents helped educate me and shape me. You as well. I made sure you were in that book because you gave me a wonderful opportunity to have my own show and to be able to extend my platform. And it's actually an extension of my parents, because I'm an extension of my parents, which I consider you as my father as well.
Right.
And people are like, really? I said, yeah. I said, you call him my dad.
Right.
And they're like, really? I said, yes. We're family. So it just gave me an opportunity to extend what I already do, a new platform.
Dr. Jenkins.
Yes.
Thank you. All
That's
right.
it. Well, he's another father, Professor Jenkins. I wanted to make sure, I wanted to honor him in this book. Unfortunately, he passed away a year ago now. I think it was last July. I've known him since I was about 3 years old. At least he's known me since I was 3. People say, well, I have memory to 3. No, you don't. Memory starts at 5 years old and up. And that's when we really remember.
Right, yeah.
But I definitely remember him at 5 years old.
Yeah.
But I was introduced to him when I was 3 years old. So he was another mentor, and I had him as an instructor. And he was a college professor at NASA with my father, and together with my father and a few other professors and administrators, they helped build the Afro-American program at NASA Community College. So I literally grew up with him, and he was part of my life. And he was like another father figure. He accepted his students, very accessible, and he mentored as his students as they were his children.
Okay.
So I wanted to make sure I mention him in this book.
You mentioned him. That's why I didn't want you to forget him with this television program. Now, once again, how can we get the book?
Yes.
Okay, and also the special offer.
Yep. So if you like to, really learn about medical marijuana, layman's terms, understand this. It's a textbook without being a textbook. No fancy terminology. Amazon.com. In the search button, you can put in Dr. Thomas G. O'Brien II. Hit the search, my book will come in, or literally type medical marijuana, real life success stories. Search, and my book will come up. If you have a condition, a qualifying condition, and you live in the state of New York, I will offer you a Bishop Birkett discount or a Church Alive Community Church discount.
Right.
Make the phone call and mention it, and I'll give you a discount. Because
Now,
this is
are
not
you
offered.
available as a physician?
Yes, I'm accepting patients. Absolutely, I am
That's what
accepting
I meant.
patients. Yes, I certified over 1,200 patients. 1,200 patients.
Oh, you are certified.
Yes. So
Right.
I'm accepting patients, and I love to have you. I love to take care of you.
Well, you're
'cause
my
it's a community.
doctor, and folk, that's why I'm here at going to 83 and, looking that good. Thank God for Dr. O'Brien, who's been there for me and educating me, just like he's educating you in this book,
Right.
to take care of yourself. Also, I want to mention that this program will be going on Facebook. It'll be going on YouTube, and folks, you're going to hear a lot about Dr. O'Brien. I want you to take this information down. You're going to get telephone numbers on the screen. All the information that was spoken to you about how to get this book is coming up in just a few minutes. And we want to thank you for allowing Stay Alive with Church Alive to come into your homes, and we want you to know that we love you with the love of the Lord. God bless everyone, and get the book.
Yes, it's